Hello, my name is Ashlee Milton, and today I will be talking about the work done by myself and my wonderful co-authors looking at how people with mental illness look for mental health information online. Let's first talk about mental health information. People with mental illness seek out information online about their mental health and mental well-being to understand themselves and to gain insights that support their lives. Many turn to online sources due to the lack of availability of offline resources like healthcare, uh, mainly out of the fear of being faced with mental health stigma when they do reach out for resources offline. This makes having high quality mental health resources online especially important, particularly with the added fact that, at least in the US, 1 in 5 adults is living with a mental illness. When we're talking about people going online to get mental health information, the internet's a big place. So, where and how are people finding information? Most people interact with a search engine on the low end at least once a month, and most people have multiple social media accounts that they are interacting with semi-frequently. So people are getting information from multiple platforms and sources, which is why we think about this in a framework of personal information ecosystems, which allows us to account for multiple and complex places and ways that people are looking for information. So with all this in mind, we had a few questions that we wanted to answer. The first being, what mental health information are users looking for and how do they assess its quality? How and where are users looking for mental health information? And what influences how users interact with platforms when seeking and sharing mental health information? For the sake of time, I will only be focusing on the last two research questions in this presentation, and even then I'll be doing kind of a high level on them. So if you're interested, the paper covers much more, so please check it out. So before we dive into the fun stuff, let's talk about our methods. So we investigated our research questions by talking to people via semi-structured interviews. We asked about their experiences finding information about mental health, more specifically about the platforms that they used, how they used them to find information, and other topics like information quality and barriers that they experienced in information seeking. We interviewed 17 people, and the interviews lasted about an hour each. So into the findings. First research question again is how and where do people look for mental health information online? Let's look at that. So people generally looked for information on search engines and social media platforms. What's interesting here is that people looked for and found information of different kinds, depending on where they were looking. So when they were looking on search engines, they were getting very clinical information as the predominant type that they were finding. Well, on social media, the information that they were getting was much more people's personal experiences. And the quote here from a participant, you can kind of see this highlighted. I had done initial Googling, but everything felt very clinical. When on Google, on Instagram, it's people talking about it, so it feels more personal. The information I got from each platform felt very different. When we did ask people why they didn't look for personal experience on search engines, one of my favorite quotes from a participant happened, which was, "The blog is dead." Many had a very similar sentiment to this. Websites for them just didn't convey personal experience in the same way that social media did. Interesting, our participants did call out that they felt that the information that they got from search engines, mainly Google, was more credible. One participant said, "I guess that's just always been how Google has been in my brain. It's just more credible," which was echoed by many others. Our participants even pointed out that they would use search engines to fact check the information that they would get from other sources. But what social media did provide was new terminology related to mental health and the context to understand what those terms meant. In a quote here, a participant points this out. The most helpful videos were the ones that had some sort of situation that they then explained with a term. The information of terminology and understanding through context was something that participants seemed to only really get from social media. You may have noticed this from the previous slide, but when participants were talking about where they were looking for information, there was a bit of this back and forth happening with each platform providing a different perspective. And when we looked deeper into this, we found that there was a cyclical pattern happening that were participants were finding information on one platform, going to another platform, then finding additional information, then going back to another platform. And so we developed the model that you're seeing on the screen currently, because we found that through talking with the participants and digging into the quotes, users would have this either implicit or explicit need that they would have. And then they would go to the platform that they were familiar with, either search engines over here or social media over here, and they would start looking for information. And depending on the platform, they would find specific types of information. And then, so say it was social media, they would find new terms, they would find personal experiences. They would then take that information and then they would go over to search engines and then fact check that information. They would find clinical information using the terms that they had learned. They would see if people's personal experiences fit into the clinical information that they were finding. But then they would just turn around, take the clinical information that they were finding and go check search engines and say, hey, does this clinical information, can I contextualize it, see what it actually means when someone's living with this experience? And so it was this very cyclical in nature. And in traditional information seeking theories, usually someone starts with a question, and once their information need has been fulfilled, they stop. Well, what we found with our participants is that they never really stopped looking for information. It kind of went into this, as a participant called it, like it became part of their online diet. They just kept like passively taking in more information, generally from social media, and continuing to think about and take in more information, kind of making it a habitual practice. Moving on to our next research question, we wanted to see what influences how users interact with platforms when seeking and sharing mental health information. And our participants focused on the barriers that they faced, mainly from two perspectives. The first being privacy. Many people were concerned about their privacy when they were seeking mental health information online. The concern stemmed from stigma surrounding mental health information and what it meant to be seen as someone with a mental illness. We had participants express that like they couldn't receive care until they turned 18 because the adults in their lives didn't take their concerns seriously. Age was not the only factor. Culture also played a role in which was showcased in this quote. These are very much Latin American thoughts, like, no, you can't have a mental illness, or if you have a mental illness and you're taking medication, it's because you're some sort of crazy person. People were also concerned with who could see the information that they were engaging with. Now, they weren't by any means mental health content creators. They weren't out there putting out content. They were worried even with people being able to see like what they were searching for or what content they were viewing or interacting with it, liking, and how that would be seen by others and what would be the lasting effects of how others would view them because of that. So take this quote, for example. I thought about creating a separate account partially for privacy reasons. I realized that my friends could check who I was following, and then they would see that I'm following these accounts for a mental illness. They're probably gonna know that I have a mental illness. The design of the platforms themselves also influenced how people were seeking. So crisis interventions was a complicated topic for people in terms of information seeking. Some of our participants were happy that the interventions were there and wished that they were there when they had earlier on when they had been seeking for information. In this quote here, we can see Instagram didn't have safeguards in place when I was on it. I think now it does. If you search for something a little concerning, they pop up a helpline, which is good. Very glad that they do that now because I didn't get that. Others had more complicated feelings when interventions were showed. Like this quote here, the last time it happened, I don't want to say it made me feel bad, but I didn't have good feelings about it because it popped up and I was like, are people worried about me? Do they think I'm not okay? The idea that they were being judged for looking for information was a barrier for them. Another aspect of the platform design was content feeds. Again, participants had complicated feelings about this. They really liked content feeds. It was giving them easy access to a lot of information that was easily digestible. Like this quote here, I get the majority of my information from TikTok because I have a short attention span. It's very fast. The way TikToks repeat with the same structure of video was very helpful, so I consume a lot of them. Um, Most content feeds on social media that are curated use recommendation systems, and so they're very good at picking up on people's influence information needs and providing them with information relevant to them. However, some did call out that there is a lot of information to take in, and you're not really getting a lot of breaks, liking it to drinking from a fire hose, and calling to the compelling nature of some of these feeds. And this quote here, if I hadn't been so compelled to continue to stay on that platform and to scroll, there's a much higher probability that I would have looked somewhere else. But instead, I stayed there and scrolled. It was like a dopamine slot machine. While platforms are providing a lot of good information, too much of a good thing can be a bad thing. So from our findings, we had both theoretical and design implications. Again, for the sake of time, I will just be going over some of our design implications. If you're interested in our theoretical implications, please read the paper. So our participants talked to us a bit about what they would actually like to see in the future for supporting their information seeking, and we've incorporated them into our design implications. Many talked about the burden of having to do the fact checking on themselves on search engines and social media sites. And they actually pointed out that they would like something close to like during the peak of COVID-19, how they had those disclaimers on content saying, this is content related to COVID-19. It has not been vetted or linked you to something. And so this came around of the idea of implementing something similar to Watch, which would allow for a community-based fact-checking system that would alleviate some of the burden that people are feeling in having to fact-check information. But it would need to be appropriately consider the stigma that still exists around mental health, even in online contexts, when deciding who could contribute to such a system. Also, given the concerns about privacy, it's important to give users with mental health more control over their online presence. Participants called out the ability to create multiple accounts. We've seen this with the rise of Finstas or fake Instagram accounts. They wanted to be able to control who could see what parts of their online presence. Not only wanting to take control at an account level, but allowing them to take control at a post level, or even having control over even having control over passive engagement. Some platforms do have these options, but not all of them. And having all of these options as standard practice would help users in their feeling more comfortable in their information seeking for mental health contexts. The last design implication is related to interventions. People had concerns over existing interventions and content feeds, and they had ideas on how to address them. The main theme that appears in both of these content feed and predetermined plans is control. People wanted flexible options for how they could control how existing systems reacted to their actions when they were looking for mental health information. An example for content feeds was the ability to reset their feed when it didn't serve them anymore. If they had gone down maybe a dark rabbit hole and they just needed to start fresh without needing to completely reset their account, like delete it and start over. Or for the intervention side, the predetermined plans, having a system to step in before you got to crisis. So to stop them from going down these rabbit holes that maybe would lead to anxiety spirals, but not something that would be considered what we would traditionally think of as crisis. To wrap, people are looking for various types of mental health information on many different platforms and are doing so in a cyclical model, but are facing issues surrounding privacy and platform design when they are seeking out mental health information. Going forward, it is important that we design systems to better support and give more control back to users so that they may better fulfill their information seeking needs when it comes to their mental health. Thank you for your time. The paper again is Seeking in Cycles, How Users Leverage Personal Information Ecosystems to Find Mental Health Information. These are myself and my wonderful co-authors. Please reach out if you have any questions.